Thank you so much. If I could have each of the three speakers come up, we're going to try to have a discussion. If anyone has questions that they wrote down on an index card, if you can please pass them forward. Now would be the time to get your questions in. So I have some questions. We heard that 1 in 6 children in Massachusetts are at risk for hunger, despite the expanding availability of school meals. You mentioned that you can't really tell from looking at a child if they're hungry or at risk for hunger, but are there any kind of key tips that you can give for telling if someone is in need? And if so, what are 1 or 2 concrete things that walking out this door someone could do to help out those children?
Well, those are 2 different questions. So I think educators are probably one of the most critical groups of professionals that see this more than anyone else. Nurses see it, doctors see it. We need to it'd be great to get the food insecurity question as part of the intake form in an ER or in a doctor's visit. I think we could do that in Massachusetts, which would arm those kids coming in. But I'm sure there are teachers that you know that keep cereal boxes and milk and snacks, et cetera, in their classroom. So I know our reliance on our partner agencies and professionals in the area of education are critical to be able to look at populations of need. We also track a lot of data. So I can tell you today, the Greater Boston Food Bank is committed to getting everyone 1 meal a day that's in need in eastern Massachusetts. So we're at 85%. That's about 52 million pounds of food. It's going to take us about 63 million pounds of food, but the target moves every year. And in such, it's communities that have very limited resources that are still what we call red zones. So even in Boston, for those that you know Boston, there's enough food going into Boston for 1 meal a day, but East Boston and Alston, Brighton, there's very little food going in to those neighborhoods. So part of it is the partnership. And I think the most important thing on your second question is get involved, be vigilant, be observant, talk to families. I think they're very embarrassed that they can't feed their children or that their child's come to school without a resource, or they're embarrassed to fill out the form. So there are lots of ways to make a difference.
Roxanne, you mentioned smarter lunchrooms. I was wondering if you could expand on that and talk a little bit about key pieces of what would need to be implemented to have a smarter lunchroom.
Well, I know that Dr. Rim spoke briefly about smarter lunchrooms as well, and we've had the opportunity to work with Dr. Brian Wansink and his team at Cornell. They've done a great job at, putting together many resources, all under the title of Smarter Lunchrooms. They've received funding from USDA, and one of their goals, I know, was to try to put this program in about 30,000 schools across the country. That was their mission. So it made sense for Sodexo to embrace this. So as part of our commitment to the Partnership for Healthier America, we have agreed to make sure that all of our schools are implementing these smarter lunchroom tactics. And it's really common sense because a lot of the tactics are easy to implement, they require minimal resources, and it's all about making the healthy choice the easy choice. We are exposed to what you call, this type of marketing all the time where, we're looking at behavioral economics. When you walk into a store, any store, they position things so that you want to buy them. They stimulate your impulses to want to take things. And it's the same sort of concept with behavioral economics and choice architecture. It's about how you're setting up your dining room so the easy choice is the healthy choice, the white milk in front of the chocolate milk, making sure the fruits and vegetables are eye level. I didn't show one of my slides, but we have creative identifiers for our schools where kids actually created the names for the broccoli or the bouncing bananas or the whatever, the blueberries. They created the names for these items, and it's just another way to engage the students in the process. But it's all about behavioral economics and designing your dining room so that the easy choice is the healthy choice.
Thanks. This one is for Paul. A couple of times earlier today, the point that 30 to 50 hours per year, every year, of nutrition education is needed to incite behavior change. And it was suggested that state departments of education could set statewide curriculum standards to incorporate nutrition education in the classrooms. What do you see as the role of statewide curriculum standards in encouraging child nutrition?
Well, first of all, let's draw the distinction between standards and the curriculum. So we don't do statewide curriculum. Sometimes we make suggestions to districts about kinds of curriculum that they might look at. In the standards, I think without breaking out separate categories, because there are a whole bunch of fields who want their particular subject broken out into a separate subject, but I think what's important is that these kinds of issues get integrated into the existing standards. So, for example, that we have science standards and we have biology standards in particular. That would be a logical place that a lot of this could be interwoven. So you have targets, you have goals that suggest this is material that's important for children to know and be able to do, and periodically we're going to test them and measure their mastery of those subjects. So I think it's a question of integrating sort of health and wellness and nutrition issues into our approach to science. And I think it's some of that's happened, but again, I think with strong advocacy for the field on matters like the development of science standards, you would see more of that happening.
The point of the point of concerns about plate waste came up a few times today. And I was wondering, not just from you, but from any of the other prior speakers, sorry.
So the Greater Boston Food Bank, the Doe Family Foundation, which you know the Does is the 99 restaurant family. They sold years ago. But they're very, the kids are very involved in quality nutrition. So they gave the food bank a ton of money to look at how do you get more fresh fruits and vegetables into the homes of families with children. And Suffolk University did the study. And it was surprising that some of our inventory was the wrong inventory. So we made an assumption that carrots, potatoes, onions were core products that all ethnic groups could use, right, based on, but they came back and said, those are great, but what we really want are the items we can't afford. We can afford those. What we can't afford is broccoli, green beans, lettuce, watermelon, strawberries. It's fascinating. So we shifted our buys. And I think this is to the point of what will kids eat? They'll eat a lot. And they will eat fresh fruits and vegetables. And this study proved it for us, and we changed what we carry in inventory to reflect the requests that these families have for the products they can't afford versus the products they can afford. So it was a milestone for us.
I would simply add to the whole plate waste conversation that a lot of the things that you've heard today about programs such as the breakfast programs, of having chefs in the schools, of having the kids engaged in taste testing, of having kids, vote for their favorite foods, the more engaged the students are in the process, the more likely they are to not waste. I really do believe in that. We had a situation in California where to a group of third grade classes, one of our food service directors took a stuffed pepper into all the third grade classrooms, talked about it the day before, talked about the ingredients, and gave every one of them a sampling of what that stuffed pepper was going to taste like tomorrow on the menu. Didn't do it with any of the other classrooms. And consequently, barely any of the students in the other grades took it, but when the third grade group came in, they wiped out. Very simple. Didn't require a lot of resources, took a little bit of time. But the more we can engage with the students, the greater the opportunity.
Great. Thank you. So I wish we could keep this conversation going. I still have a lot of questions written down here, but in the interest of time, just to summarize, we heard that there's about the critical role of school meals in reducing child hunger, the importance of nutrition and cognitive functioning, and the importance of equitable opportunities for child well-being both during school and outside of it. So thank you to the audience for your attention, and to our speakers for really a phenomenal session, and also to the conference planners for a wonderfully informative and inspiring day.